President Trump's coronavirus task force coordinator, Dr. Deborah Birx, is speaking out in her first TV appearance since leaving the White House. In an interview with Face the Nation's Margaret Brennan, she describes a pattern of disorganization, misinformation, and censorship.
There was only one full-time person in the White House working on the coronavirus response.
How is that possible?
Well, that's what I was given. So what I did is I went to my people that I've known all through the last years in government, all 41, and said, can you come and help me? And so I was able to recruit from other agencies, individuals, but there was no team, full-time team in the White House working on coronavirus.
Since the pandemic first reached our shores, more than 25 million Americans have been infected by the virus. Another 419,000 have died. There is some good news. There are signs the rate of increase in cases is slowing. For more on this, let's bring in Dr. Julie Morita. She's the Executive Vice President of the Robert Wood Johnson Foundation and a member of President Biden's COVID-19 Advisory Board. Doctor, thanks so much for being with us. So the president has a goal of 100 million doses of vaccines over the first 100 days of his first term. Dr. Deborah Birx, though, says that there is no infrastructure behind any of the initiatives the federal government is proposing right now, all because of the poor job the Trump administration did in handling the pandemic. So how will this impact the Biden administration's goals?
Good morning. Nice to see you both today. So I think a critical thing to keep in mind is that there is a strong vaccine infrastructure in place every day. We vaccinate millions of children on a routine basis, and there is a core infrastructure that includes CDC, state and local governments, and public health agencies, and so we're able to vaccinate. Building on that system is challenging. It requires additional resources, more money, more people to actually get that work done. And what's been outlined and what's been mobilized is to build upon that infrastructure. And President Biden has actually committed to making more resources available and also has committed to having stronger federal leadership so there's better coordination between the federal agencies, state and local governments. And so there actually is potential to really ramp up this system. The system wasn't necessarily well coordinated. When I look back about prior public health emergencies and how well coordinated they were at the federal and state and local level, we didn't see that previously, but we should expect to see more of that moving forward.
So vaccine experts, though, warn that, there will be shortages in the vaccine, at least in the short term. The director of the CDC said, we don't really know just how much vaccine this country has. How can the Biden administration ensure that there's enough vaccine to meet their goal?
So we're seeing increased delivery of the vaccine. So the initial phases of the rollout of the vaccine were on the slower side, but that's to be expected because it was two new vaccines that were very different than previous vaccines. It took some time for the states and locals to actually ramp up their systems, and now they're actually doing better, and you can see that the rate of vaccination is actually increasing. What we've heard from the Biden administration is that there's going to be this federal leadership and coordination. There's also a commitment of resources to make sure that the Defense Production Act is really optimized, and so that the materials and supplies that are necessary for development and manufacturing of the vaccines is really supported, and also that there's additional resources going into those agencies that are actually doing the vaccination.
So, Doctor, it wasn't just Dr. Deborah Birx speaking out about how the Trump administration dealt with the crisis. Dr. Anthony Fauci, who, as you know, is the director of the NIH and chief medical advisor to the president, has recently described the difficulties of working under the Trump presidency. It's important to note, of course, that both Dr. Birx and Dr. Fauci are career public servants. They've worked for numerous administrations, both Democratic and Republican. But this pandemic has turned what should have been a public health issue into a political one. Do you think we can get back to the point where the American people are able to trust these government agencies to provide truth and facts instead of promoting the interests of whoever is in the White House?
I think we're already seeing signs of return to more normal public health and more routine public health emergency responses. When I think back about my time in public health in Chicago, whether it was Ebola, whether it was Zika, whether it was H1N1, there was strong federal leadership, clear, consistent messaging coming from the top. And so it was really, the public didn't have as many questions or uncertainty or was less distrustful because there was this consistent and clear messaging and heavy reliance on data. And we're seeing that. It was just over the weekend, you could see it was Dr. Fauci, it was Dr. Walensky, it was a number of different people in leadership clearly speaking out and talking about what the plans are and relying on the science and the data and the facts that are available.
I want to play a little bit more of Margaret Brennan's really fascinating interview with Dr. Deborah Birx. One of the things that she said to Margaret was that she had to deal with coronavirus deniers inside the White House, and she felt like those individuals may have helped to derail the government's response. Let's listen to some of that sound.
I mean, until the day I left, I'm convinced there were parallel data streams because
disinformation.
I saw the president presenting graphs that I never made. So I know that someone out there or someone inside was creating a parallel set of data and graphics that were shown to the president. I know what I sent up, and I know that what was in his hands was different from that.
So there is all kinds of information about this virus out there from many, many sources. And even, so for Vlad and I, every day we talk to a doctor about the latest information. And even today, we talked about a couple studies, but that we had to really sort of underline that, one study was very preliminary, or another study was, conducted by the drug maker and had not been peer reviewed. I can only imagine that within the Biden administration, within the White House, there is a massive volume of data. How is the Biden administration approaching this pandemic differently when it comes to the data that they look at and the decisions that they make related to that data?
It's a really great question. We in the past and moving forward, I'm hopeful that there'll be a clear reliance on the federal agency expertise. There are career officials that have worked for years and years at CDC, at FDA, at NIH, who really committed themselves to science and evidence and actually coordinating and working together. What we didn't see in the prior administration was that kind of coordination and reliance on data and respect for those career officials and what they bring to the conversations and to the decision making. And as we move forward, as evidenced by President Biden's commitment to science and evidence, convening an advisory board made up of a wide variety of medical and public health experts to advise the transition team, the leadership team that he's putting together, you can see that there's a clear commitment to science and evidence and data. And I'm hoping that there'll be a clear and consistent use and reliance on the career officials who are at the CDC, at the FDA, at the NIH.
So one interesting thing, Doctor, is the president has rolled out these numerous actions, including an executive order to wear masks on federal property and a mandatory quarantine for those returning from international travel. Question on the masks. With these new variants that are being discovered in the United Kingdom, in South Africa, in Brazil, there are some doctors who are suggesting that Americans need to ensure that the masks that they're wearing are no longer those cloth masks or those buffs or bandanas that people were sort of using, that you may need to actually use surgical masks. If that turns out to be the case, are we at a point in this country where we're producing enough of those masks so that everybody can have one?
There's good evidence that mask wearing does make a difference in terms of prevention of disease, both in terms of getting sick and also infecting other people. And the CDC has regulations and recommendations for what masks are most appropriate to use. They give guidance regarding the number of layers that are necessary. They also give guidance regarding how they should fit around your face. This kind of information is really critical to be adhered to now, while we're learning more about the variants. I think we do know that these variants are out there. We know that they're more transmissible. We also know that not everybody's vaccinated right now. So the dependence on these masks is really critical at this point. And using the CDC guidance, which is very clear about the kinds of masks that should be used and when people should be wearing them, is really, really essential. I'm really glad to see that there's these federal mandates to actually have the mask being worn in places that they can mandate it. And then also the president's commitment to work with governors and state and local officials to actually encourage them to mandate that mask wearing as well.
Doctor, in regards to the CDC guidance, I think there are times that the CDC, confuses people sometimes more than it helps. And this is what I'm talking about. So the CDC is now saying that people can switch to another vaccine for their second dose. The agency also says that patients can extend the interval between doses to 6 weeks instead of the original recommendation of 3 or 4 weeks. And this is not what the FDA approved. We've been talking about how quickly Operation Warp Speed was able to get these vaccines made available, how the FDA, that this made sort of allowances so that we can get this vaccine to the public, that this isn't sort of the typical way things are done. And then we hear the CDC saying, the guidelines that were in place before, we could probably move them around a little. I think this makes people very uneasy. Why are we getting this new guidance now on the way the vaccine can be administered?
Sure. I think to many it may appear like that's a confusing message, but actually when you look at the CDC guidance, it's very clear. What they recommend is that the vaccine follow what's the FDA approved, which is 21 days between the first and the second dose for the Pfizer vaccine and 28 days between the first and second dose of the Moderna vaccines. Sticking to that as closely and as frequently as possible. What they did say is that you could extend the period of time between them in extenuating circumstances. So there wasn't a need to revaccinate someone if they were delayed in getting their vaccine. So that's the reality. That's the practical application of what FDA approved, is that there will be some people who actually might not be able to get the vaccine in the 21 days or at the 28 days. And if they did get it a little bit later, they don't necessarily need to be revaccinated. And that's what the clarification was. And the same applies to whether or not you get the same dose of Moderna or whether you get the same dose of Pfizer vaccine. The recommendations that CDC put out were not that you should use them interchangeably, but that if someone, because they didn't know which vaccine they got to begin with, because the same product was not available when they're ready for their second dose, that if they didn't have the ability to get the same dose for certain, that it would be okay or acceptable to get it. But that's not optimal, and that's not what's being recommended. So I think it might appear to some superficially that there's confusing messaging, but when you look at the guidance, you can see it's really meant to be, those guidance are created just to make practical responses for people who are actually vaccinating people and may encounter people who may have uncertainty about what vaccines they got, or may have gotten a dose a little bit later than they were recommended.
Dr. Julie Morita, that is really, really helpful. Thank you very much.
Thank you.
All right, so don't forget that you can stream the full interview with Dr. Deborah Birx on CBSNews.com or, of course, by downloading the free CBS News app.